This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, July 7th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. Government and medical officials in the United States on Tuesday are scrambling to contain a major surge of COVID-19 cases as the death toll in the U.S. now tops 130,000 people, according to Johns Hopkins University. The U.S. leads the world not only in terms of coronavirus deaths, but total number of confirmed cases with 2.9 million. The U.S. reported over 50,000 new daily confirmed infections during the first week of July, with many states posting a record number of single-day new cases. Dr. Anthony Fauci, the nation's top infectious disease expert, says the U.S. is still deep in the first wave of the COVID-19 pandemic. The dramatic rise in new coronavirus infections is prompting authorities in some states, including California and Florida, to reimpose restrictions. Now to Africa, where Kenyan President Uhuru Kenyatta's order allowing travel in and out of Nairobi, Mombasa and Mandera counties went into effect Tuesday. Kenyatta says, quote, "The relaxing of travel restrictions should not be taken lightly and people should avoid reckless behavior." The president also announced that international flights will resume beginning August 1st. Kenyatta, however, extended the nationwide 9 p.m. to 4 a.m. curfew for 30 days, warning that if the rate of the outbreak worsens, the country may return to a more stringent lockdown. Kenya has recorded more than 8,000 coronavirus cases and at least 164 deaths. The first human trials for a potential vaccine against COVID-19 is ongoing in South Africa. The research is by Oxford University. Clinical trials are studies performed by researchers primarily to find out, among other things, if a new treatment like a drug or vaccine is safe and effective in people. To find out more about the process of clinical trials in Africa and their safety, Africa 54 health correspondent Lino Mudu spoke with Dr. Bartholomew Dike Akanmori, Regional Advisor for Regulations of Vaccines with the World Health Organization's Regional Office for Africa and in charge of the Secretariat of the African Vaccine Regulatory Forum.
Professor Dike Akanmori, thank you so much for joining us. First, would you please explain what clinical trials are and why they are so important?
Clinical trials by themselves are essentially studies which are designed carefully, managed in a very controlled manner to ensure that products can be evaluated in humans as study participants, ensuring that the safety of the participants is assured, while at the same time ensuring that you're able to obtain the necessary data or information that is required for the licensure of the product so it can be made available to many more people.
Critics say Africans are often taken as guinea pigs during those trials. Talk to us about that. What is your reaction?
To tell you the truth, far from this, within the continent of Africa, the systems are in place, the regulators and the ethics committees are in place. Gone are the days when clinical trials could be taken lightly and people could come from outside the continent, go into any country, a small town, village, and conduct studies on human participants. Now it is impossible to do that because each country has a national regulatory authority, and this national regulatory authority is mandated legally to be responsible for ensuring that all clinical trials are properly regulated. On the continent today, there is the African Vaccine Regulatory Forum. Now, this is a network of all the regulatory authorities and all the ethics committees within the continent.
To what extent are countries capacitated to regulate equally?
I mean, it's precisely for this reason that the countries have come together, because then they are actually watching over each other's shoulders and trying to, make sure that they are all doing the right thing. It is also under the umbrella of the African Union, under the African Medicines Regulatory Harmonization, which brings together all the regional economic communities, ensuring that they work collectively as an umbrella, giving oversight to medicines regulation on the continent, including clinical trials oversight.
I was listening to a patient who enrolled in the clinical trial for COVID-19 here in the United States, and she was talking about the type of scrutiny she went through in terms of her health, the type of tests that she had to go through, and how the researchers and everybody involved was taking care of her in very specific detail. So there's a clinical trial ongoing in South Africa right now, which is in collaboration with Oxford University. What is the process with people in Africa with these trials? How much assistance do they receive during the trials when they participate?
Let me first begin by saying that clinical trials should be the same regardless of where they take place, because there are international guidelines, there are international declarations, there are international commitments on human subject research, which are respected all over the world, which should be implemented all over the world. So in principle, there should be no difference whatsoever between the rights of a subject or a participant in research in the United States and a participant in research on the African continent. Clinical trial application must contain all that the researchers intend to do. It must include the care which is going to be given to all the participants in the research. And indeed, that standard of care is critical, is vital. Now, the standard of care may vary from developed countries to low and middle income countries, based on infrastructure, based on the availability of specialists and experts to look after patients or subjects. That is understandable, but within a country, you cannot deny research participants the basic standard of care which prevails within that country. And I expect that in South Africa, that the investigators will abide by this. They also have the benefit of the guidelines which were developed by the African Vaccine Regulatory Forum, or AVRF, and other guidelines by the World Health Organization.
In part two of Lino Mudu's interview with Dr. Bartholomew Dike Akanmori, he elaborates on the importance for Africa to participate in clinical trials. South Africa's Market Theatre is one of several African cultural institutions that has recently gone entirely online because of coronavirus restrictions that prevent large gatherings. But for this small institution, often known as the Theatre of the Struggle for its flouting of apartheid-era laws, obstacles are nothing new. Now they hope their artistic message, which touches on local and global events, will resonate beyond the continent. VOA's Anita Powell reports from Johannesburg.
The show must go on, if only online. Johannesburg's Market Theatre is no stranger to struggle. The theatre opened in 1976 at the height of South Africa's racist apartheid system and made a point of flouting segregation laws. And so now, as a global pandemic has made live shows impossible, the institution's artistic director says they're seizing the opportunity to spread their stories well beyond this country by streaming their entire season online. Not only that, they're writing brand new topical shows that touch on the issues many South Africans and people across the world are facing right now.
We are going to commission some of our finest playwrights to create works for us, that at the moment, these short plays that are between 20 and 25 minutes that we are producing for the virtual space.
South African actor and playwright Paul Slabolepsy says it is more important than ever that art continues to be made.
Without art, we are nothing. We explain ourselves. Our conversations come through storytelling. If we were living just with the struggles that we have, with no hope, life would be terrifying.
National theaters in Algeria and Egypt are also doing live shows online. And Somalia's National Theatre recently reopened for Independence Day celebrations, and hopefully more. Meanwhile, major theaters on New York's Broadway and London's West End have also gone online. Cuomo says the theater has gotten an enthusiastic response to its online offerings from people in the U.S., Europe, and other African countries. But he believes that the continent's artistic houses could do more. His theater is communicating with institutions in Ghana, Namibia, and Zimbabwe to help them go online.
In most places around the continent, it's very sad because some places might not have the infrastructure that you find in other countries that I've mentioned, and South Africa. And so we are always looking at an idea of working with countries that, especially Anglophone countries.
The doors may be closed and the seats may be empty, but the show goes on. Anita Powell, VOA News, Johannesburg.
Native Americans consistently experience higher rates of unemployment than their fellow citizens. With the coronavirus hitting the Native American population disproportionately hard, the combination has caused undue hardship, especially for people of the Navajo Nation's reservation. VOA's Julie Tabo reports.
Where Utah meets Arizona sits Monument Valley. Its iconic sandstone formations make it the crown jewel of the Navajo Nation reservation, the biggest Native American territory in the United States. But lately, the park has been empty and its access forbidden.
During this time, every season, there would be thousands and thousands of visitors per day, but because of the pandemic, all our scenic destinations are closed.
Locals suffering from a lack of income are lining up at the park's entrance, eager to pick up donations of water, food, and cleaning products.
It's really helpful for the families, especially us who don't have money and don't have a job right now.
Jonathan Nez says it took too long for the U.S. government to send federal funds.
The CARES Act was intended to give relief to all U.S. citizens throughout the country. But the first citizens of this country, of this land, didn't get immediate attention.
The Navajo Nation has been hit hard by the COVID-19 pandemic, suffering the highest case rate in the country. For the past 2 months, the number of confirmed infections has continued to grow. But in this small health center, only one doctor is on duty. Dr. Key carries out his consultations in a parking lot.
Hello, Dolly.
Hello.
How are you doing today?
Dolly Crank tested positive for the coronavirus.
Well, I called this morning earlier that I wasn't feeling good, that my coughing starting to get worse with my breathing, shortness of breath.
We do seem to have a population that is very susceptible because of the diabetes, heart disease, obesity, and the fact that in the homes that there's very little space and a lot of people living in small spaces.
In the sovereign territory the size of Ireland, at least 30% of residents do not have running water. Many families depend on public water stations like this one. Amanda Larson and her 3 children fill up a dozen big bottles.
We come every couple days, every 3 days we come and we refill all of these, and this is all the jugs we have. Yeah, daily routine, in and out.
Larson must ration water to cook, wash clothes, and bathe her children.
I would have my kids wash at least every 2 days, but now that this pandemic is here, they're washing basically every day. To me, it's embarrassing. It's degrading. It's heartbreaking for my kids.
The pandemic has also become a challenge for the nation's oral history. Transmission of knowledge, essential among Native Americans, has been carried out within families for centuries. typically by the elderly. But since they are the most vulnerable to the virus, many are scared they will lose this living memory.
For our ancestors, they're the wisdom keepers. They have the knowledge.
Navajo families are singing and praying to protect their elders. And they're staying home, confined in the big open spaces of the American West. Julie Tabo, VOA News.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, big companies boycott Facebook in the US, demanding more action against hate speech and misinformation. We'll be right back.
People, now you ready to ride?
Hello, I'm Linor Moudou, your VOA Health correspondent. During the COVID-19 pandemic, the World Health Organization says there are currently no drugs licensed for the treatment or prevention of COVID-19, and there is no proof that hydroxychloroquine or any other drug can cure or prevent coronavirus. The misuse of hydroxychloroquine can cause serious side effects, illness, and even lead to death. For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. Infographics, temperature checks at the entrance, infrared lamps, and mobile app-operated elevators. Experts say post-COVID office spaces are going to change dramatically. And while the majority of offices in the United States remain empty as people continue to work from home, architects are busy working on new office space standards. Maxim Moskalkov has our story.
Real estate developer JBG Smith is currently constructing Amazon's corporate headquarters called HQ2 in Northern Virginia. The builder recently presented its plan for how U.S. employees might get back to the office safely.
If you look at our plan, it's intentionally laid out in a way that is sequential. So we start with sort of the arrival sequence and all of the things that are different about our lobby design, all of the signage that we have added.
It is large public areas that worry specialists the most. Every day, hundreds of people push elevator buttons and grab door handles in the main office areas. Special mobile apps for employees could allow employees to operate elevators hands-free.
There is going to be permanent changes, right? So I think that some of the key things that we've been exploring are what we call the touch points of the buildings. And those are certainly things like entries, elevators, and toilet rooms and restroom areas. And so everything that we're exploring right now is trying to minimize the touching of things.
Before the pandemic, the developer's main task was to have as many workstations in an office building as possible. But with the new reality, those priorities could change. Workers might also be encouraged to get outside more.
One of the new trends in post-COVID-19 office building design is going to be, and it was already heading this way, but now it's going to really go this way, is more outdoor space. Developers, again, used to not want to spend money on a lot of outdoor space because there's a perception and probably somewhat of a reality that it's not used, especially if in Texas when it's 110 degrees in the summer.
Real estate experts say the demand for office space could go down significantly after the pandemic. Since a lot of people will continue to work from home and existing office spaces might need to be repurposed. Twitter CEO Jack Dorsey already announced that all his staff can work from home indefinitely, even after the pandemic is over. Other technology giants like Microsoft and Zillow are expected to follow suit.
We're a little nervous that people are not going to be building buildings, but what is going to be happening is people are going to be taking their existing space and thinking about how they can reconfigure it.
Office space changes will lead to changes in housing as well. During this pandemic, many people ended up working in their bedrooms and kitchens. But in the near future, developers will start designing apartments and homes with mandatory office space. Maxim Moskalkov for VOA News, Washington.
For Democrats, the reality of the coronavirus pandemic is forcing a change of plans. Instead of staging an arena-packed event to crown Joe Biden as their presidential nominee, they will hold a virtual convention. VOA Steve Reddish has this report.
For Democrats, the reality of the coronavirus pandemic forced a change of plans. Instead of staging an arena-packed event to crown Joe Biden as their presidential nominee, they will hold a virtual convention.
We don't know that much about this virus, but what we have learned is that it transmits in closed indoor spaces in close proximity to people. So that says, oh, maybe you shouldn't have a convention, a traditional convention.
Thousands of delegates are being told not to travel to the convention city, Milwaukee, Wisconsin. Democratic Party leaders will be there to conduct necessary business in a giant virtual meeting.
Other than the backdrop of 20,000 people packed into an arena, it will still be television.
Democrats reportedly plan a mix of live programming from Milwaukee with curated content to fill 4 days of primetime television programming, leading up to Biden's acceptance speech as the party's presidential nominee.
But I think that the Democrats' sort of certainty around planning this is going to serve them better. And what I mean by that is that the Democrats have time to plan. They have time to consider innovative technologies. They have the freedom and the latitude to put kind of effort and energy into how do we create the best sort of virtual event we can create.
In early April, Democrats postponed their convention, originally scheduled for mid-July, to begin on August 17th, just 1 week before the Republican convention, to renominate President Donald Trump, who insists on a traditional celebration.
I think the most important thing for the parties at the conventions is to get their nominee in front of an arena-sized crowd that is cheering and screaming and applauding. And there has always been, as in the television era, there's always been pressure to do that.
Once the governor of the state of North Carolina required convention attendees to wear face masks, Republicans decided to do the party's business in the host city of Charlotte and instead chose Jacksonville, Florida, to host an event celebrating President Trump's renomination and acceptance speech.
The Republicans are divided in both their intentionality in terms of the business meetings for the delegates and the rallies for the people. But there is a problem in that they're not only having to kind of negotiate two separate locations and dividing up events, but they are also putting themselves kind of at risk of having to adapt on the fly. And adapting on the fly when it comes to technology is almost always bad.
At the end of June, the city of Jacksonville began requiring face masks at indoor events. Steve Reddish, VOA News, Washington.
Companies such as Coca-Cola, Adidas, Ford, and Lego are boycotting Facebook this month, pulling ads that appear on the social network in the United States. Some advertisers are part of an organized boycott, demanding the company do more to crack down on hate speech, conspiracies, and misinformation on its site on topics such as voting. Facebook is responding with some changes, But will it be enough? Michelle Quinn explains.
Hundreds of companies say they won't advertise on Facebook and its sister firm, Instagram, in July as part of a campaign called Stop Hate for Profit. The goal? Force Facebook CEO Mark Zuckerberg to address Facebook's negative effects on society, says Jim Steyer, chief executive and founder of Common Sense Media and one of the boycott's backers.
That they are amplifying hate speech, racist messages, white supremacy messages, all sorts of misinformation and dishonest political advertising. So we asked the major advertisers of America to pause their advertising on the platform for at least a month.
The boycott's demands include asking Zuckerberg to strengthen controls against hate speech and do more to crack down on misinformation campaigns, particularly when it comes to voting. These are all changes that Facebook can make.
It is within their interest to make small changes. They don't want to be blamed for somebody using their platform to manipulate people in an election. But tinkering around the margins of little changes to ensure that doesn't happen is very different from actually taking a step back and saying, is it possible that the core business we built is actually not the best thing for society?
There's no shortage of ideas of how to fix Facebook. Some call for regulations. Others say break up the company and make Zuckerberg, who has controlling shares of the firm, answerable to a board. One idea? Hire ethicists to help with decision-making and give them power in the organization.
I don't think there's any one core set of values. I wish there was. And I wish it was some sense of trying to help the common good or trying to protect human rights or something that really helped them be a guiding principle.
Facebook says it doesn't tolerate hate speech and points to its automated system to remove inflammatory ads before users see them. Recently, the firm agreed to an external audit of how it is doing to make sure advertisers do not appear next to harmful messages, one of the boycott organizers demands. Facebook also said it would label content that breaks its rules, even those posted by an elected official, and it will remove posts that Facebook thinks may lead to violence or deprive people's right to vote. These are important steps, but some critics argue it's not enough.
Yes, they can change. It's a question of whether they want to. Can they change as long as they continue to pursue being the biggest, most dominant company in the world that absolutely has a monopoly over all conversations, how we get our content, how we connect with people? Possibly not.
The boycott organizers say their campaign is going global, but it will take time before they know if their efforts have a lasting effect. Michelle Quinn, VOA News, Oakland, California.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.